Um, yeah, so denial can be a big contributor if folks are not willing to accept that, you know, they have an issue and this is something that needs to be changed. In addition to these psychological interventions, we also have drug treatments that we can use. So one example is cyproterone acetate, and this is essentially something that's sometimes called chemical castration. It reduces testosterone, and by doing so, it reduces sexual desire, arousal, and fantasy. Of course, it only works so long as you're using it. Medroxyprogesterone, better known as Depo-Provera, also has a similar function. But the issue with both of these is that success depends on continued use. So if someone stops taking their medication, stops getting Depo-Provera, they're not going to have that reduction of testosterone. So folks really have to be willing to do that. Gender dysphoria. So this is going to be not a paraphilic kind of disorder in that same way that we were talking about, but this is an issue with gender and sexuality. So we'll discuss it here. Gender dysphoria is when someone's physical sex doesn't match who the person feels like they are, their sense of themselves. And you can think about this on a continuum to some extent. Like you might have interests that are less traditionally associated with your gender. So maybe if you're a woman and you really enjoy, hunting and fishing or martial arts or something like that, or you're a man that, is very interested in fashion or something like that. Now, these are like very, we don't all necessarily fit into super traditional conceptualizations of gender. But some people, for some people, that mismatch between their biological sex and the gender that they want to be is so great that they actually want to change the sex that they're born with. And this is really different from transvestic fetishism. Transvestic fetishism is focused on sexual arousal, sexual pleasure, that sort of thing. Folks that are engaging in transvestic fetishism, like dressing, maybe as a woman as a means to increase arousal, are not interested in becoming women. Whereas for gender dysphoria, the person really is, they want to become the opposite sex. It does sometimes happen among folks with disorders of sexual development, meaning that their genitalia are somewhat ambiguous, or maybe among people that have hormonal differences, and especially more so in the past, folks were usually assigned sex at birth. So if you were someone that was, not clearly male or female, doctors would choose, maybe whatever it seemed like you would be easiest to classify into physiologically and make those changes surgically and with hormonal treatments. Some of those approaches have changed some over time, but that is something that has occurred. And again, this is different from being masculine or feminine. Sometimes people think of maybe homosexual individuals that have more masculine mannerisms as a woman or more feminine mannerisms as a man, and this is again not the same thing. The desire to become the opposite sex is key to gender dysphoria. Gender identity is independent of sexual arousal patterns. Sometimes folks think that if someone is a trans woman, then they are going to be attracted to men, and it's not necessarily the case. They might be attracted to females. It's a separate kind of thing from that sexual arousal component. And in some cultures, it's actually considered an honorable kind of thing, as something that has like a seer or a spiritual role. what causes gender dysphoria? So there is some genetic component if we think about twin studies, and there does seem to be an aspect associated with hormonal exposure during development. There are structural brain differences that suggest that there might be a really biological component to this, like the brains of men that are interested in becoming women might be more feminine. Although there's still a lot that we have to learn about this area. There really does seem, though, to be a biological kind of component. So this is one of these case studies that really illustrates some of this. There's a little boy that during circumcision had actually had his penis burned off. And, the parents are very upset. The doctors, make the suggestion like, hey, our best approach to this might be raising this person as female. So let's reassign the gender, and we can construct a vagina here and raise this person as female. So then they became Brenda. And this person really never adjusted to this assigned gender. They did not like feminine clothing. They tried to pee standing up. They really identified as masculine. And finally, as they were becoming teenagers, they were becoming increasingly upset and distressed by this. And the parents, finally told them like, hey, this is what happened. And they chose to live as a male and eventually have surgery to, to create genitals and live their life as Bruce. So this was, just kind of an example of how some of this is biologically influenced in people, how extensively. Currently, our approach to this for folks starts with education and psychological evaluation. And whatever physical changes are made usually start very slowly and starting with least intrusive stuff. So starting maybe with hormones to shape some secondary sex characteristics. Having the person live as the opposite gender prior to having what is called sex reassignment surgery, which is where the person becomes physically, anatomically consistent with their gender identity. Usually other components that folks will think about would be like being stable financially, socially, and psychologically. They have to live in their assigned gender that they want to be for a year or two to make sure that this is something that they're comfortable with, this is what they really want, because it is a pretty significant surgery, and you want to be sure when you're making that decision. And there's different kind of changes that we would do for trans women and trans men. So, trans men, you might have breast removal, trans women, electrolysis to remove excess hair, hormones, and of course genital construction as well. Most people are satisfied after sex reassignment surgery. Trans men generally adjust a little bit better than trans women, possibly because there's some aspects of living as male that might be less challenging. There is a proportion that do regret the surgery, and that's what that aspect of really living as your newly chosen gender is about, to make sure that this is something that you want. And there is a small proportion, unfortunately, that do attempt suicide. So we definitely want to avoid that as much as possible. Things that might predict regret. So for those folks that aren't happy, it could be poor family support. So if the family is really not supportive of the person making this transition, it could be comorbid psychopathology like psychosis or alcohol use disorder. And it could be a misdiagnosis. Like if they didn't really have gender dysphoria, there was something else that was driving this change, they might not be happy. We do have different approaches towards treating gender nonconformity in kids. So sometimes this is where a child might behave in a manner that's not consistent with traditional gender norms. Let's say, a boy that really loves to play with Barbies, a girl that, is really interested in being a tomboy, wants to play football, something like that. Maybe wants to dress as the opposite sex. Different kinds of expressions like this. Some people argue that, we should just let Children, do whatever feels right to them. Others are worried about potential for bullying and scorn. Like if a boy is, showing up to school wearing a dress, is that boy going to be bullied and mistreated by other kids? Are they not going to fit in? And there's different options that folks consider. One approach is to try to reduce these behaviors, assuming that this is something a child might be exploring. If we reduce it, they're not really going to be that damaged by it, and maybe that's an easier way to help them fit in. Others argue for watchful waiting, so just letting whatever happens naturally occur, and this really requires support from the community and caregivers, so for other people to not have negative responses to this and to accept whatever the child might want to express themselves as. A third approach is actively affirming gender nonconformity. So seeing that, it's great that you're trying these things out. It's great that you're exploring, and we don't currently know which course is best long-term developmentally. So this is something that we don't necessarily have extensive research or understanding of. Regarding disorders of sexual development, so cases where someone might have ambiguous genitalia or something like this, it's actually not tremendously uncommon. There's about 2% of the population that has some ambiguity regarding sexual development. And the current perspective, because of cases like Bruce and Brenda, is to help the person adapt and to help them take time to develop their own gender identity, rather than just assigning through surgery when a person is very young, because that you might not necessarily have a good sense of what gender they would identify with. All right, so I want you guys to do one of these check your understanding activities. So I'm going to give you the question to go through on your own, but when we return to class, you can ask any questions. If you want to go through this, we can check to make sure you have a good handle on this. So I want you to explain the treatment methods of covert sensitization and orgasmic reconditioning, and describe what these two methods have in common. So just to repeat that again for you guys, explain the methods of covert sensitization and orgasmic reconditioning, and tell me what these two treatments have in common. So that's it for today's lecture. I hope you guys are having a good Thursday, and I will see you soon. Please feel free to email me if you have any questions. I will be back next week, and you're welcome to stop by office hours to chat about anything that you might want further clarification on. Take care.